Hello and welcome to another episode of Shop Talk. I'm Dr. David Anderson, and again with me is Dr. Suhel Kotwal. Today we're going to talk about spine practice at Kansas City Joint Replacement Sports Medicine, because Dr. Kotwal has a very good breadth of knowledge in spine, being fellowship trained, not just in spine surgery, but two other areas as well. But today we're going to talk about spine surgery. If you could tell the people watching your interest in spine, what Menorah has to offer you as we really develop this program here at Menorah.
Thank you, Dr. Anderson. It's a very exciting time to be a spine surgeon with the influx of new technology like the robotic navigation and virtual reality. And Menorah Medical Center offers all those amazing technologies at our fingertips. And it's all heading in the right direction, where we are taking much smaller incisions with minimally invasive spine surgery, placing implants more accurately, monitoring nerves and blood vessels during surgery. So the incidences of neurological deficits is incredibly rare now. And we promise faster recovery, many times outpatient spine surgery as well.
And these are patients who have been typically suffering for a long time with nerve pain down their legs or into their arms. And so the robotic technology is incredibly fascinating. Certainly both have used it for hip and knee applications, but for the spine, you think about the precision of a robotic screw placement or the overall robotic precision really makes that three-dimensional thinking about the spine optimal for better outcomes. Mm-hmm. And so I think that's what patients want to hear, and about the quicker recovery. So what have you seen with the utilization as far as quicker recovery?
That's a great point, Dr. Anderson. Spine is highly misunderstood, and people feel that it requires long-term bedriddenness after surgery and lack of mobility. It's contrary to popular belief. That's not the case. With minimally invasive surgery and guidance of robotic navigation, patients can have very small and tiny incisions, sometimes just Band-Aid type incisions, and can be on their feet rather quickly, the same day many times, more often than not.
Would you say this is helping decrease post-op opioid use, improving patients' outcomes earlier, so we're getting back to work sooner, those type of outcomes? And that's what we see at the hip and knee world. I think certainly in the spine world, those benefits are also seen.
You absolutely hit the nail on the head. We have to dissect less. We don't have to elevate muscle of the bone as many times. We can approach the spine through smaller incisions, through tubes, and perform the surgery microscopically with robotic arms. And hence, since we are not causing that kind of surgical inflammation, we can get the patients back on their feet very fast.
I mean, I think the imaging we have available and this technology over the last 15, 20 years has grown so much from when we did our initial trainings. Mm-hmm. And so it really has come a long way from what we remember early in our training to this now farther along. And I think it's just very exciting to have that here at Menorah Medical Center with your skill level and certainly your passion for treating patients with spine disorders.
This hospital is an excellent platform to develop an excellent spine practice and deliver top-of-the-line quality care to struggling patients for years, which have not found answers to their problems.
So if you're struggling with some type of neurologic or spine pain, and it's something that you'd like to have a consult with Dr. Kotwal with, you can reach out to Kansas City Joint Replacement Sports Medicine. And we look forward to seeing you in our practice. And thank you for watching another episode of Shop Talk.
Thank you, Dr. Anderson.